Has it felt like more people you know are getting sick lately? Well, you're not imagining it. Cases of the flu have been spreading.
Calgary usually has their flu season start first, and I don't think any of us are really know why. And this year the whole thing was pushed back by about 4 or 5 weeks compared to the last 2, 3 years.
That's infectious disease specialist Lenora Saxinger. She says it's unusual to see a split between two strains of influenza A. In the last week of Alberta Health data ending January 4th, H1N1 made up about 32% of infections, H3N2 59%.
H1N1, which is the pandemic strain that emerged in 2009, does tend to hit younger, like working adult age groups a lot harder. And then the classic influenza pattern is that, the H3N2 pattern would be that it affects the extremes of age. So people who are more at risk because they're very young children or older people. And so with a mixed year, you kind of get all age ranges impacted.
If you live in Calgary, you could be at higher risk of picking up a bug. We're also seeing the bulk of this season's RSV. Edmonton a little ahead when it comes to COVID.
Calgary zone has over double the number of hospitalizations so far. So there still is a considerable burden of illness in the health system.
This flu season started several weeks later than it has the past 2 years, meaning the number of infections is lower so far. Craig Jenny with the University of Calgary says that trend could continue, considering a recent decrease in the weekly report.
Perhaps a little early to know where the numbers are going to be in the next couple of weeks, but it's encouraging to see that steep rise begin to slow down and maybe stop. So the hope is that we have hit peak for at least this strain of influenza.
But Jenny says the best way to avoid getting sick is to get immunized.
If we look at the end of last year's flu season, it was our lowest vaccine rate in about 12 to 15 years. And it ended up being the highest number of deaths to influenza that Alberta had ever recorded. This year, unfortunately, we're trending far below that immunization rate, and we will see at the end of the year what impact that has on hospitalizations and fatalities.
Vaccination rates in Alberta's two biggest cities are about the same, around 21%, a little higher than the provincial average. 25 people have died from the flu so far this season, the youngest in their 20s. Horwood, CBC News, Calgary.